Oh, Mm. Oh, that felt so good. Like usually I get this section when I crack it, so that felt good. That's incredible.
Very nice.
Oh my god. Is that a normal amount of cracking?
How long have you had low back pain for?
Since about the 8th grade.
Why specifically 8th grade?
Oh, so there was an incident where I was playing basketball with boys. It was a co-ed league, and one of the guys like kind of grabbed the ball and pulled me back, and ever since then I felt like my back hasn't been the same, and it just kept getting worse and worse. I feel like from all the getting hit, I played college sports, and I just feel like it's never gotten right.
What did you play in college? Lacrosse?
Lacrosse, basketball, and cross country. I was a 3-sport athlete.
Cool.
That did not take care of their body.
Well, tell me, what's your activity level like now?
So I just finished a kickboxing program. It was just a month long, but I went every single day. But recently I just got a coach to compete in a bodybuilding competition. So it's been very intensive lifting and my body is sore.
Are you getting more than soreness? Does your body feel good when you're lifting?
Yeah, it feels fine. I think when I stand for long periods of time, my back really hurts. When I'm driving or in something restrictive like tight clothing, my neck will start to hurt.
What's long periods of time mean?
If I'm standing for like more than 30 minutes, my back will start to hurt.
30 minutes isn't a long period of time.
That's feels long to me sometimes.
So you have a history of back pain. It started when you were much younger. You had it treated then, but you stopped getting it treated. You continued to have a high impact lifestyle, pretty much at the highest impact activity you can do, you know, bodybuilding and or powerlifting.
Yeah.
So it's really important to kind of like key in on some of these like body feelings that you're having. That at 26 years old, you should actually, really at any age, you should be able to stand for 30 minutes without your back telling you that it's time to sit down.
Yeah.
How often do you have the neck pain? So like every day?
Every day. My back and neck hurt every day. So.
Do you get headaches? Do you ever get any pain that goes down your arms? Numbness or tingling in your fingers?
Yeah, I do get tingling in this finger, like pins and this hand, like pins and needles. I always thought it was weird, specifically when I like raise my hand above my head. I don't know if that means anything. Like if I'm like scratching my hair, I like will notice it, but I never knew what that meant.
All right, tell me about your headaches. How often do you experience headaches?
At least once a week usually, but it lasts all day.
Where on your head does it hurt?
Usually like between my nose.
Does it feel seasonal?
It probably could be. I'm allergic to everything.
All year round allergic to everything?
Well, animals, and I have animals. That's probably it.
It could be.
My own doing. I think I might have TMJ, not diagnosed. My jaw, like, pops a lot. I don't know if that means when I chew. Only other injury I have is I broke this pinky. I had to go to pinky therapy.
No.
Yeah, it was horrible.
Does your jaw hurt or does it just click and pop?
It just clicks. It doesn't hurt.
Let's start off. I'm going to watch your gait, and then after that, we're going to do some exam stuff, and then I'll get you adjusted.
Okay.
Okay, looking at the feet first. Heel strike, mid stance, and toe off. Look bilateral and symmetrical. If anything, there's just a slight eversion on the right comparatively to the left. Go back the other way. You can see on the right side, the right pinky toe just kicks out a little bit more to the side on the mid stance. The left pinky toe goes straight forward. All right, looking from the knee down, I don't see any genu varum, no genu valgum. That looks straight away. That's good. From the knee up, I don't see any angulations of the hip. Hip sway from left to right looks symmetrical from here so far. I don't see any possible restrictions there. The arm sway looks good, so the general fluidity and motion is balanced. All right, looking at the shoulder height, there's a high left shoulder, and mastoid process looks about even. All right, arches are intact. All right, I'm gonna use the back of my hands for a temperature measurement now. Back of the fingers are more sensitive to temperature. Definitely a change in the lumbar spine here. This it's very symmetrical, even from top to bottom, until right about here, right till we get to the lumbar curve, and then it comes back to warm here over top of the sacrum. But there is a decrease in the warmth here, right over top of the lumbar. Here, there's an asymmetry in the muscular hypertonicity here on the left lumbar. What does this feel like compared to this over here? Same? Left, right.
The left is a little bit more short.
Okay, let's do this. Bring your ear down to your shoulder. Bring this ear down to this shoulder. Does it feel more restricted on one side or than the other?
This side feels more restricted.
And that's the side it just cracked on too. Okay. A lot of those cracks are just like superficial cracks. A lot of times when you can crack your neck every day, it's because there's one thing that's really, really stuck somewhere. Okay. And because that thing is actually not moving the way that it should, the cracking happens in all the other parts of your spine.
Oh, that doesn't sound very good.
Tracing up to the bottom of the glute folds here, we're definitely lower on the right side. So the right one's a little bit, so the right one's telling us that it's rotated like this, posterior. The left hip may be rotated anterior, we'll see. If this is where all the tension is, and that's where the pain is on palpation, this is most likely the primary. All right, so now looking from the top, let's say, just making your toes, make your toes even for me, please. Good, okay. Now looking from the top view, there's no, it's maybe slightly more external on the left, so that might mean it's rotated externally on the left. Okay. We saw the eversion on the right foot, so that doesn't show up in the right glute, so that's good. All right, now let's see, go ahead and close your eyes. Okay, I'm looking for swaying motion right now, so just very gentle swaying from left to right or forward to backwards. All right, it's pretty steady, not a whole lot of swaying going on here. There's a little bit of lateral sway, but not really enough to call it a category 2. Okay, I'm gonna watch how your sacrum moves while you're moving, okay? Okay. So let's do this. Go ahead and bend forward and touch your toes. Gonna come back up. Okay, left side. Let's do that again. Left. Come up. Comparing to the right. Go ahead and bend. And come up. There's actually more movement on the right, on the left than the right. Tender right there. Mm-hmm. 1 or 2, which is more tender?
Do it again.
1, 2.
Maybe 2, but both.
Yeah. 1, 2, 3, 4. Ready? 1, 2, 3, 4. Which one?
4.
1, 2, 3, 4. Right there.
And 2. 2 and 4.
Yeah. This is the 2 was here. So this is trap fiber 2. This corresponds with the thoracic segments T3, T11, and T12. So we're going to hone in on those segments first. First, we're going to loosen up some of these muscles. We have some hypertonicity in the upper right thoracic spine here. A little tense right here, right? Mm-hmm. And this lower left stuff definitely softened out that we're not seated anymore, which is good. Any tenderness here? Mm-mm. Good. Here?
A little bit.
Do you have any tenderness here, L5?
No.
L4?
No.
T11?
A little bit there. Okay.
Ticklish or tender?
Ticklish.
Okay, breathe through it. Nose breathing. Breathe. 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 Out. In. Left versus right.
Left.
Yeah, this is tender, right?
Mm-hmm. Mm-hmm.
Okay, this is glute medius. I'm just going to give this a little bit of a push here for about 10 seconds. Good, yeah, good breath there. You're going to take some nice deep breaths in and out through your nose, okay? Breathe. Almost there. Breathe. Relax.
Oh.
Do a little stretch here, nice and gentle breathing. All right, you ready to get some things cracked?
Yeah.
That's still tender, right? Okay. 3, 4. How about that one? Is that one still tender? We're gonna start at T1, 2, 1, 2, 3. Okay, T3. Nice and gentle, this guy. That's tender, right? So as you breathe out, I'm going to follow your breath down like this. And then when we get to the end of your breath, I'm going to push like that, okay?
Okay.
All right, let's give it a try. Deep breath in and out. Good. Sinking in. Let the shoulders sink in. Very nice.
That was good. I feel like that's been tight for a while. Yeah, I don't think I've ever had that cracked before.
Nice.
That feels good.
Down to T11, 12. Okay, so first let's find the segment. This should L5, L4, T12. Okay, nice and gentle. Okay, we're gonna breathe in, and then at the top of the breath, that's when I push for this one. Okay. So
Okay.
breathe in as far as you can. Go all the way in, all the way in. Good. And then let your shoulders relax as you breathe out. Let it go. Good job.
Thank you.
Okay, we're gonna do the T6 here, and then we can do L2. Okay, deep breath in, far in as you can go.
Okay.
And out. Good, gentle, gentle, sinking in. Let the shoulders sink in.
That felt good.
So this is how we adjust the low back, okay?
Okay.
I'm gonna bend the top leg like this. Good. I'm gonna bring hips forward, so like that, right there. Okay, nice and gentle. Okay, go ahead and take a deep breath in and out. Good. Bringing the hip down like this. Good.
Oh,
Good. Okay, lay it back.
that felt really good. That felt so good. Yeah, that's not the part I usually crack on my own. I feel like usually I get this section when I crack it. So that felt good.
Okay, nice and gentle. The side very similar. As you breathe out, we're going to stretch in that direction. I'm going to bring the hip down like this. We're going to push from right here. Go and take a deep breath in through your nose and out. Good. Letting the shoulders sink in here. Very nice. Good.
Oh,
Now you're back.
that felt so good. Oh my god. This is like a relief. Just gonna savor the moment.
Lean back. Keep breathing. Keep breathing. Good. One more. Let's go. Good.
Oh.
Okay, I'm going to shake your hamstrings. Let your legs go down flat. There you go. Normal. This is fine. You're good. Normal. You don't have tight hamstrings.
Oh.
Now let's do this. Go and turn your head to the right. Now turn your head to the left. Back to center. Bring your right ear down to your shoulder. Back to center. Left ear. Back to center. Good, just try to let your head completely relax. Good, you don't have to help me. All right, I'm going to do a 1 range of motion check here, okay? Just let your head completely relax into my hands. Good.
Okay.
Nice and gentle. Breathe through your nose. Good. As you breathe out, just like the other adjustments, we're going to do a very gentle push in this direction like that, okay?
Okay.
Good. Good. Everything's sinking into the table.
Whoa. That was fast. That was crazy. Huh.
Nice and gentle as you breathe. Good. Very nice. Good. Sinking in.
Oh, holy. Almost said some choice words. That was good. Whoa. Oh, that was a good one. Oh. Don't. My toes have never been cracked.
Good job. You're doing good. All right, just relax your... Yeah, there you go. Let that go. And then, like, relax your feet, too. It only really is uncomfortable when you're there. When you resist it. That was okay. Let it go, though. Let it go. Okay, we'll skip that one. Let this go.
Oh, that felt good.
Let this go. Good. Okay, go ahead and squeeze.
I think I just popped something in my groin. Was that supposed to happen?
Yeah, that's your pubic bone.
Oh, okay.
Okay, this is an organ of digestion manipulation, okay?
Okay.
So first we start with the ileocecal valve. This is the window between the large and the small intestine, okay? You locate it first by finding your belly button. Yours is here, okay? This is your ASIS, okay? Yours is here. You're ticklish, okay?
Yeah.
This might be difficult. Sometimes it is the ticklish people. Give me this hand. Okay, putting your hand on my hand decreases the sensation of it, okay? It can decrease some ticklishness. Okay, now try to breathe and relax your hips a little bit. Okay, your ileocecal valve is here. It's a little tender, right?
Mm-hmm.
Feel how it's a little harder right underneath my fingertips, though.
Mm-hmm.
We're right on top of the valve. The valve is closed right now, and that's okay. Just gonna very gentle massage right behind it and in front of it. I don't feel anything that's like really stuck here, which is good. So no lower GI stuff for you, no constipation or the other way around. Pretty flow, good flow.
Mm-hmm.
Okay, now I'm going to come up to the pyloric sphincter. This is where the stomach empties into the small intestine. Okay, which is above the belly button. Yours is there. Keep your hand right on mine. That's good. Okay, this is also good because you haven't eaten recently in the last 2 hours, so this is clear right now. It's good. Deep breath in right here. There's a small release right here that needs to go. Good. Did you feel that?
Yeah, I did.
Oh. Okay, that's tight. That's good. Okay, now it's a gentle breathing. I'm going to use this like this. That's okay if I do that?
Mm-hmm.
Okay, here and here. And then as you breathe out, we're going to follow the breath. And we're going to go in this direction. I'm going to pull like that, okay?
Okay.
All right, let's give it a try. Good. Gently sinking in. Shoulders and hips. Very nice.
Oh my God. God.
Breathe.
Ah, that was a lot.
Very nice.
Oh my God.
Breathe.
Ah, that was a lot.
Yeah, it was. It was big. It was a good job. Yep, keep breathing.
Oh, I felt that in my spine.
Yeah.
I just spit. Oh my God. I've never had my neck cracked like that before. Is that a normal amount of cracking?
That was a ton of cracks. No, that was like 75 cracks. Yeah. Yeah, I'm surprised that there was still stuff. You had some occiput stuff going on. It was very well hidden, but we got it out there. You felt that in the low back too, right?
Everything. I felt that. I was not expecting that at all.
Mm-hmm. Very nice.
I feel different. I feel lighter, like I'm floating. Whoa. That feels good. What? That's incredible. I've never been cracked. I thought I could crack everything in my body myself, but that was some next level. It's impressive. I'm still like surprised. Like still in shock.
Yeah, it takes a minute. Yeah.
I can't believe how many bones just cracked. It just feels like flowy. You know? Like it doesn't feel like restrictive, which I guess I didn't know it was restricted before, but now it's like such a difference. That's crazy.
Ceiling. Can you come back more? There you go. First, your thumb is next. Okay, let this relax right here. Oh, that was subtle. This pinky or the other one?
It's the other one.
Here, sit nice and straight. Look straight ahead. Okay, go like this. Put your hands on your hips. Good. Push here. Good.
Oh, okay. What was that? Okay, sorry. Next one. That's nuts.
Okay, left or right is one more tender than the other.
Right.
Okay, rechecking. Right, left. Is the right one still more tender? Shoulders sink in. Very nice.
That was good.
And let your shoulders relax as you breathe out. Let it go.
No, that felt really good. That felt good. That felt good. Oh, okay.
Okay, go ahead and squeeze.
I think I just popped something in my groin. Was that supposed to happen?
Yeah.
That's nuts.
Okay, nice and gentle. Okay, go ahead and take a deep breath in. Good.
Oh. That felt so good. Oh.
On your back.
That felt so good. Just gonna savor the moment. I can't believe how many bones just cracked.
Everything's sinking into the table.
Whoa.
Good, sinking in.
Oh, That's incredible.